Well, we'd like to say officially welcome one and all to another Mikey Live program. I am your host, Mikey Hutchinson, and we are coming to you live from the Spice Isle of the Caribbean, that is Grenada. We are just coming out of another lockdown weekend. I hope that you're good. I hope that you did something, that you enjoyed, something you haven't done in a long time, but you were proud that you did it anyway. You got the opportunity to listen whole weekend while drinking bush. Real bush. Because we don't go in long just so. You understand? Take a little look online and see somebody the bushes are good for, whatever it is you might have and things like that, and just as proactive measure and things. So you boy drink real bush and the whole day are drinking bush too, just for the heck of it. Anyway, folks, let's say welcome again and let's talk about what's making the headlines for tonight. Here's what. NDC has some recommendations for the government of Grenada. There's a weather system that we need to watch. In fact, there might be two. Grenada's positive cases declining while the deaths increasing, and more fixed penalty tickets issued this weekend than the previous lockdown weekends. We'll talk about that. Agri-Food sector development and the strengthening of the national food safety system in Grenada. And former trade union leader doesn't agree with the Public Workers Union. We'll tell you on what. Prime Minister assures the healthcare providers, the nurses and so on, that they will be duly recognized and rewarded. That's right. We'll talk more about that. A new health center in Gouyave is to be used for the first time. We'll talk about that. We have other things to tell you about right here on Mikey Live. It's a pleasure to be back with you. It's a pleasure to have you with us. And of course, this is what we call news discussed, not told. We do not have a horse in the race. We tell you as it is. Who vex? The face is theirs. We have a balance. You understand? This is where it all happens. We're talking about the good, the bad, and the Mikey. So folks, take a little drink of water, eat a little crick something. We're taking our first break and come back. But before we do that, just remember, someone sharing tonight's program, and that person could be you, right, wins some free credits, compliments, Digicel. So you go ahead and do the business, yes? And of course, we got to let you know the headlines was brought to you through the kind compliments of the Communal Cooperative Credit Union, Coach Grenada Limited, Digicel, Nawasa, the Housing Authority of Grenada, Superb Distributors, and the Real Value IGA Supermarket. Thank you to all our sponsors, and of course, we appreciate you and our viewers as well. So folks, we're taking the first break, and when we come back, it's going to be real news in Ole Lili Lolo. So brace all yourself, we come in.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform. Place your order, then go out and enjoy your day to spend more time with friends and family. Delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
Let's get tough on breed-your larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all the people, 300 for police for them thieving fellas. To all the farmers, please don't steal produce from your brother. Then you're selling to traffickers, hotels and street vendors. Nah man, let's do all we can to stop breed-your larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report breed-your larceny, call 300.
After being locked down during the pandemic,
get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
It's your summer Summer Everything Loan from the Communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a Summer Everything Loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your Summer Everything Loan from the Communal. Apply today and take advantage of this exciting offer. Visit the nearest Communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NOWASA, committed to meeting customers' needs.
Alrighty, again, we'd like to officially welcome everyone to another Mikey Live program. And to the first time viewers, we say hello to you. And those of you who are always here, well, hello as well. Now, the traffic department of the Royal Grenada Police Force would like to advise the general public that the Bonaire Bridge, St. Mark, will be closed to vehicular traffic from today, Monday, 27 September, and that will be for a period of 1 week. They say that this closure is necessary to facilitate repair work in the area. Members of the public, you are encouraged to use alternative routes. And the Royal Grenada Police Force would like to thank you for your cooperation and understanding, and they say that they regret any inconveniences caused by this. As well, there was one motorist in the Gouyave area who wanted to appeal to other drivers who attempt to use the Mabia road to get to Gouyave or from Gouyave, that is not possible now because there's a trench that's dug across the road, and that is why you're seeing no entry signs at both ends of that particular road. They're advising, for the sake of yourself, your own safety, and of course to save yourself some gas because you'll drive and then realize that you have to turn back, please follow the no entry signs. And for those people who are going to Gouyave, use the Mount Nesbitt Road to get to Gouyave, and for the people who are coming from Gouyave to St. George's, use the Douglaston Road. Please be guided accordingly. And the new health center in Gouyave, while we're on that, is to be used for COVID-19 testing and vaccination, and that was as of today. And that's according to the Ministry of Health. All right, they're saying that the top floor of the ultra-modern Gouyave Health Center will be designated the COVID-19 testing and vaccination center for the St. John St. Mark Health District. Following his recent visit to the facility, Health Minister Honorable Nicholas Steele welcomed the addition of the new site as his ministry ramps up the COVID-19 testing and vaccination throughout the island. The Community Nursing Division, led by Mrs. Hannah Julian St. Paul, that's the permanent secretary with responsibility for hospital and community health services acting, and Mrs. Carol Telesford Charles, chief community health nurse acting, as well as the district medical and nursing teams, have also endorsed the designation of the facility as a vaccination and testing location. In recent weeks, Grenada has seen a steady increase in the number of COVID-19 infections as the country transitioned to community spread. Health authorities have therefore been undertaking various public health interventions, including increased public education, testing, and vaccination to curb the spread. COVID-19 testing and vaccination will be conducted at the Gouyave Health Center every Monday, Wednesday, and Thursday from 9 a.m. to 3 p.m. In the ongoing effort to protect both the staff and clients, all persons must follow the established protocols, right? The COVID-19 health and safety protocols, all right? Such as the proper wearing of face masks to facial coverings, also the hand sanitization and physical distance while visiting the facility. Now, clients can also choose one of two available COVID-19 vaccines. That's the Pfizer. It is administered to individuals who are 12 years and older, and the AstraZeneca is available for those who are 18 years and older. Persons are reminded to walk with a valid photo identification card, such as your driver's license, your NIS card, or passport for quick and easy registration. Now, those returning for their second dose, you are reminded to walk with a vaccination card that was provided to you when you received your first dose. The Ministry of Health encourages the public to be patient and cooperative with the staff when visiting the Gouyave Health Center or any health center for that matter. Now, talking about health centers, the Prime Minister assures the healthcare providers that they will be duly recognized and rewarded. He says he wanted to empathize with the doctors and the nurses and other frontline healthcare workers across the country who have been at the forefront of Grenada's fight against the COVID-19. In recent weeks, with the country transitioning to the community spread and the exponential increase in the number of COVID-19 cases, healthcare workers, already stretched due to limited resources, have been put under immense pressure as they provide care to the increased number of persons requiring medical intervention. You understand? They have also been made to come face to face with the tragic loss of many lives, multiple deaths. Sometimes in one day, the other day we had 13, in one day we had 12, then we had 10. You know? And these numbers are crazy. When you check out some of the other countries, right here, Grenada winning, hands down. When it comes to deaths associated with COVID-19, hands down. What Grenada is, we always have to star. Well, I don't know what's the cause for that. Crazy. You understand? Now, during a series of meetings with the doctors and nurses at the country's hospitals this week, the Prime Minister said it pains him to see that our nurses and doctors are bearing the brunt of the crisis, having to put their lives at risk every single day. It's a burden on them. You understand? And then he was also talking about the fact that in some countries, doctors and things dying, doctors and nurses dying out of COVID. Well, we know that, luckily, we know no doctor, no nurse that has died directly from COVID-19 as far as we know. The Prime Minister is assuring the healthcare providers that they will be duly recognized and rewarded for their role in this unprecedented battle. He says that he appreciated the work that they do, one thing like that. You understand? So let's see. You understand? Them doses are telling all the way. I have to put away the family and thing. But anyway, lately that talk. We're going again. How we looking? Earlier, the National Democratic Congress says that a collaborative approach is needed to combat the pandemic. It can't be a one-thing thing. You understand?
The NDC believes that this is a time to put differences aside and unite to overcome this national crisis. In fact, an inclusive, collaborative, united approach to fighting COVID-19 has been our position since the pandemic began. The fight cannot be won without input from political parties, labor, the business and religious communities, and civil society, together with government and frontline workers.
Now, the acting political leader of the National Democratic Congress, Mr. Adrian Thomas, says that he met with the Prime Minister and had a few recommendations.
The NDC believes that this is some of the proposals the NDC delegation put to the Prime Minister and his team included: 1. Increasing the number of testing and vaccination centers to minimize crowding. 2. Establishing a separate isolation unit for COVID patients. 3. Recruitment and training of health workers and volunteers. 4. Approaching Flow and Digicel to assist with PBX lines to improve hotline services. 5. Embarking on a public education campaign with new faces, especially national cultural figures. 6. Reviewing the 48-hour quarantine period. 7. That relief measures be administered by non-partisan or bipartisan groups. 8. Asking utility companies to put a hold on disconnections for a period to be determined. 9. Asking banks and credit unions for a moratorium on mortgage payments. And 10. The formation of a national COVID-19 task force to include political parties and other interest groups.
Thank you very much. And that's some of the proposals put forward by the National Democratic Congress, and that is to the government of Grenada in terms of a strategy for moving forward, in fighting the current outbreak of COVID-19 in Grenada. All right, so we're moving on. And so the next thing that we have to tell you about, boy, so what we have seen based on the numbers that are coming to us is that there's been a decline, a steady decline in terms of the number of new cases that are showing up on the dashboard. Yeah, no, we don't know how to attribute it. We don't know how to categorize this because we do not have the number of testing or the number of tests that were done. I know that it came up in the last post-cabinet briefing that we had, and they say that it's something that they're going to consider and so on, but we have not been seeing those numbers and so yet. So we do not know if less tests are being done. That is as a result. That is why we are seeing. But I highly doubt that we're doing less tests. There's no reason for that, right? So, but just to say that at least the fact is we are seeing less numbers coming in terms of the new COVID-19 cases. So on our last dashboard, there were a total of 93 new cases. That was on Sunday, 93 cases. And also we've seen that the active cases have declined as well. And that is owing to the fact, because we can actually see that, in the number of persons that are recovering. So active cases stands at 1,943, and out of that, the local cases 1,936. Hospitalized, we are seeing the numbers going down there as well. 66 persons in hospitals around Grenada, and total cases since we first got our first case it stands now at 4,922. We are nearing the 5,000 mark. As it relates to recoveries, 2,859 recoveries thus far. The deaths are not pretty. We stand at 120. 120, that's way higher than it should be. In fact, in other Caribbean islands, this is really high. For the amount of deaths per infection, Grenada is starring there, and we probably could do better. I don't know. I want to talk to, and I've already started setting up an interview with a healthcare provider, someone in the field, to find out what is the cause? What do they think is responsible for the high amount of deaths? Yes, and I know that a lot of people have speculated. A lot of people want to know why. And so we too would like to know why. And I have set up, so it's just a matter of schedules meeting, and then we'll be able to have that discussion with the healthcare provider. All right. As it relates to our lockdown weekend, it seemed that people are getting comfortable and are finding ways around it. In fact, we heard from the police today that more fixed penalty tickets were issued today than any of the other lockdown weekends, the previous lockdown weekends that we have had recently. All right, and that is not good at all. Persons who are attempting to breach the law where the regulations for the weekend is concerned. And so they were met by police, and police say that they had to issue quite a bit of fixed penalty tickets. All right. We are moving on. The next thing that we have to tell you about, is that the European Union and the Caribbean Development Bank, the CDB, in collaboration with the Grenada Bureau of Standards and the Marketing and National Importing Board, they'll be launching the project Agri-Food Sector Development and Strengthening of the National Food Safety System in Grenada. And that will be done on Wednesday of this week. Now, this is a Euro 8.75 million resource, million euros resource, which will seek to enhance Grenada's national quality infrastructure and to strengthen Grenada's obligations to the World Trade Organization, the WTO, in the area of sanitary and phytosanitary measures for food safety. Now, Grenada is the sixth beneficiary of the CARIFORM European Union Economic Partnership Agreement, the EPA, and the CARICOM Single Market and Economy, CSME, standby facility for capacity building, which is financed by the 11th European Development Fund, the EDF, and administered by the CDB. Now, the Marketing and National Importing Board, the main beneficiary, will receive 3 refrigerated trucks, while the Grenada Bureau of Standards and the Ministry of Agriculture will benefit from training in the areas of hazard analysis, critical control points, HACCP, and post-harvest handling techniques. Now, the launch will be a blended event with the Minister of Finance, Honorable Gregory Bowen, and other local delegates delivering remarks at the conference room of the Ministry of Works, and the delegates from the European Union, CARICOM Secretariat, and the Caribbean Development Bank will deliver their remarks virtually as well. So probably we'll try to see if we can bring that for you so that you can get more details on the rollout and stuff like that, because I too am very interested in this. All right, we are moving on. Now, the former trade union leader, the Grenada Technical and Allied Workers Union, we're talking about Chester Humphrey, disagrees with the Public Workers Union, the PWU, in their stance as it relates to the Prime Minister meeting with the nurses last week. Now, if we had to just give you a little background on the business now, The Prime Minister held a meeting with the frontline workers, the nurses and things last week. So many nurses go on Facebook and they complain and they say, listen, that man make us feel like we're nobody. That man make us feel old. We feel beat up. And that's what the Prime Minister said. He thought it was a very fruitful discussion. You know, because they spoke of what some of the issues confronting the nurses and so on. And the Prime Minister also gave a commitment that he will look into some of those concerns. Well, the Public Workers Union was not happy about that at all. He says, since when? There's an organization that is responsible for negotiating and discussions in the interest of these workers, and there are issues on the table already being discussed and so on. So why did the Prime Minister see the need to bypass the union and go straight to the workers? You know, last week he had on the program Daisy Hazard, and she was talking about that. She said, well, since when?
It's very represented by the Public Workers Union. They are also represented by the Nurses Association and other affiliate groups. These are groups that are ratified across the region and internationally. So any government, any Prime Minister that wishes to speak with nurses about what's affecting them, the rightful place to come to, as the authorities in Grenada know, it's a union. This is where you sit down to work out, to identify and to work out the issues confronting workers. And those issues have been duly and resoundingly placed on the table by our union and by the Nurses Association. So first of all, it was not necessary for the Prime Minister to have a meeting with workers to find out what the issues are.
Thank you very much. That was Daisy Hazard. Now, Chester Humphrey, who was once the leader of the as I said, the Grenada Technical and Allied Workers Union, said, well, wait. When does the trade union get that kind of idea? Where did they get the idea from? That the Prime Minister needs their approval to meet with the workers or any sector of workers. The Prime Minister is the Prime Minister, he's the leader of the contract. He's the leader of the contract. And so if he chooses to meet with anybody, that's his right. He could do that. You know, you have a song like, I could do that. He didn't can he do that? So, just I say, well, I don't understand when they come out with that piece. Yeah, I mean, I wish I had it, I was ready. I couldn't get the clip ready for all it tonight, so I had to tell all the wives, hey. You understand? So that's what the man say. You understand? If the Prime Minister wishes to meet with anybody, he has all right to do so. You understand? Anyway, lately that talk, lately that piece, I see me Virgin, hey, Rafi, what going on, dog? Why it is, Virgin? When you come in, dog, we good. You understand? Anyway, lately that talk. I see me Pana Grimes. Why is it Grimes? Yeah, right? Anyway. Alright, we're moving on. So Olia. So here the next piece now. Yeah, boy. Watch now, when Daisy look you in the eye, you had to humble yourself. I editing a little clip there and I see Daisy turn so on, she turn straight into the camera and she look the camera in the eye, I do back here. Yeah, I feel like if it's me she talking to. Yeah, I made it. They say hell have no fury. Like a woman's scorn, you know, when the woman come out, you know, it's mass, you know. Anyway, take all the time. Alright, big up Daisy on the program, we'll talk to you tomorrow. That's me partner Brian, we'll talk tomorrow too. Hey, also here the next piece now, that's a serious one now. The weather today, like seriously, anybody who's in Grenada today knows the kind of weather we had today. The weather was funny. Thunder, lightning, noise in the place, boom, 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 not a drop of rain in some places. Sun hot. You understand? But it's boom, 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 boom. You understand? Husband and wife fighting, mass play. And then there were some areas that had some intermittent heavy showers and scattered showers. Yes? So we were affected by a system. But Trinidad is claiming that they had hail. I ain't making it up. I'm not making it up. There are some videos that come out on social media. They say hail in Trinidad. You understand? Well, we don't know without the proof. Well, we just see video and people say Trinidad and all kind of thing. Let me leave that talk. We're going again. But coming back here, last week we told you that we needed to monitor these systems as they are showing signs of further development. Now, we have already heard from the Met Office here in Grenada about these systems. And I think it's this one will affect us today. We got like a ban. We got a ban. All one ban is Carnival, it's August, so we're in September now. All one ban, all get banned. So we got a ban from that one that caused the whole thing today. But these two systems here are what we need to look at. So according to the National Hurricane Center, and as well the Met Office, a broad area of low pressure located several hundred miles southwest of the Cabo Verde Islands is producing a large area of disorganized showers and thunderstorms. Environmental conditions are conducive for further development, and a tropical depression is likely to form during the next day or two while the system moves westward to west-northwestward, as you can see on your screen, at 5 to 10 miles per hour over the central tropical Atlantic. Now, they are saying that the formation chance through a 48-hour period is just about 70%, and the formation chance over a 5-day period is very high at 90%. And then the other system that we must also monitor, but that one seems to be less of a concern, but still is there, a tropical wave located just offshore the west coast of Africa. So the one that we just talked about is the front one, and then now we are talking about the back, right? So a tropical wave located just offshore the west coast of Africa continues to produce a large area of disorganized showers and thunderstorms. Upper level winds are conducive for gradual development, and the tropical depression is likely to form in a couple of days while the disturbance moves westward to west-northwestward at 10 to 15 miles per hour over the far eastern tropical Atlantic. Now, they're saying for that particular system now, formation chance through a 48-hour period is high at about 70%, and over a 5-day period is also high at 90%. And so these two systems will be systems that we are monitoring over the next few days. According to the Met Office, who we heard from about these, they are saying that currently these systems pose absolutely no threat to Grenada at this time. So it's very conditional and time sensitive. All right, so let's see. Let's see how this progresses, all right? So we're going to monitor these. Okay, so the next thing that we have to tell all about, boy, we're running out of time, boy. All right, let me take it down. We scream. Next one. How are we going? How are we going for time? Some of all you on Facebook all come late. In fact, nah, it was me. It was I. I realized that you guys clicked in late. So the program started way longer than you came in. We already started on YouTube and then realized that you guys were not on as yet and we had to put you on. So you missed about the first 5 or so minutes of the program. All right, so anyway, earlier, Pfizer has started testing its potential COVID-19 treatment as a preventative medicine. Here's what, that is aimed at warding off the virus if a close contact gets it. All right? So they are saying that they will study the pill. It's a pill. It is developing in combination with a low dose of the HIV drug. All right? So it's a HIV drug, a low dose of that too, in people who are at least 18 years and older and live in the same household as someone who is infected. Now, Pfizer plans to enroll about 2,660 people in the late-stage study. Now, those participating will get either the treatment combination of a fake drug orally twice a day for 5 to 10 days. All right? So they're saying that this is something that they're taking piece by piece, and see how it goes. And then if the study shows positive signs, satisfactory enough, then you'll see that. One of the concerns that people have is that, hey, how do we live? How do we really realistically live in the same household with someone who is infected with COVID-19 and not be at higher risk? What can we do? Because even when you isolate people in certain rooms, in the homes and so on, there's one bathroom in some cases. Some utensils are few. Utilities. There are a lot of things that one has to access. And it makes it really hard to get it right all the time. I mean, if you take a look at all the cases that are in Grenada that were secondary cases in households, and when I say secondary cases in households, I mean there's somebody who's affected or infected, and then someone else in the household who's been trying to be safe gets infected as well. You know, that is happening a lot here in Grenada. All right, so there will be a post-cabinet briefing tomorrow, God's willing, and a lot of questions will be asked. I think there's going to be a new panel. There's going to be a new panel tomorrow, I think. What time alone will tell. Yes, time alone will tell. Family, I see that we are running up to time, and if you allow me, I will take a quick break and come back. Right? Because we need to break sometime. Break, drink a little bit of water in the program, but I ain't drinking water. I look at see inside a cup. If I look at see inside the that's the real thing. Let me tell you why they're in there. Ginger, moringa, big thyme, lemongrass, honey, garlic. Get out of here. And listen, it has other functions. It makes other parts in the body. Follow me now. Them can cook up, make other parts in the body function like a boss. You know what I mean? So I don't know whether it's for cold. I don't know. I just drink anything. You understand? I don't drink anything because I find it making me feel good. Yeah. According to Stanford Simon, good. So we're taking a break and we're coming back. If you want some lemongrass, you can get a piece. Yeah, you can get 2 leaf. You know, being a moringa. Boss function. We're taking a break and we'll be back. When we come back, we've got the national report, we've got the weather, and once we get the how to call it, then the dashboard, then you'll get that too. All right. So we come in, take all the time. Sherry bean is no man, white tail, sherry bean is all here. Hey, we coming back. Let me drink me concoction. We coming back.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
Let's get tough on breed your larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all the people, 300 for police for them thieving fellas. To all the families, don't steal produce from your brother. Then you sell it to traffickers, hotels and street vendors. Nah man, let's do all we can to stop breeding larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report pre-deal larceny, call 300.
After being locked down during the pandemic,
Get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by
Superb Distributors Inc., Tempe, St. George's.
It's your summer everything loan from the communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Summer is ending, but the deals are just beginning with the Quartz end of summer sale. Get up to 50% off your favorite items, to include patio furnishings, pools, coolers, TVs, mattresses, and more. Plus, shop today with the ready finance and pay nothing for 60 days. Take advantage of these sizzling summer deals for a limited time only. Shop in store and online at shopcourts.com. Conditions apply. Quartz, bringing value home.
A message by the Grenada Distillers Limited.
You want a hand sanitizer to do 3 things: kill germs, be gentle, and to go where you go. You can get all of that in our hand sanitizer. Hard on germs, gentle on hands, affordable. Remember, hand sanitizers contain alcohol. Keep away from heat and flames and avoid contact with eyes. Available at retailers island-wide.
A message by the Grenada Distillers Limited. Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 143-114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NOWASA, committed to meeting customers' needs.
Prime Minister Dr. The Right Honourable Keith Mitchell pleased with turnout at vaccination and testing clinic over the weekend. We'll have details to this story and more in the National Report. With the details to the news for Monday, September 27th, I am Rikisha St. Louis. Despite the inclement weather on Sunday, more than 300 residents from the communities of Cherry Hill to Mount Morris showed up at Pier 57 to get tested and or vaccinated. Of the 344 people tested, 332 were negative, while 12 tested positive for COVID-19. 118 persons were vaccinated, 99 received their first dose of the Pfizer vaccine, while 8 had their second dose. 5 persons received their first dose of AstraZeneca, while 6 had their second dose. Prime Minister and Parliamentary Representative for the area, Dr. The Right Honourable Keith Mitchell, during an interview with the GIS, said the turnout of residents clearly suggests that people are now taking the pandemic very seriously.
We constantly indicating that this virus respects no one at all, and therefore having a number of people here doing the testing and vaccinating is important. And in addition to the fact that you see a lot of different age group, because I think the general perception before was that the virus only it deals with the older persons in the community. That's not so. We see the death of young people who are not known to have any physical problem before. So I think this is important for us.
The objective of pop-up clinics, Dr. Mitchell says, is twofold, as it is equally important for people to be both tested and vaccinated. The opportunity, he says, should not just be used to get tested, but to be vaccinated as well, as it is the only tool available now to effectively fight the virus.
You have to keep coming back and testing all the time, and you never know. And therefore, it's important to take the next step to vaccinate, and I think that's the message we want to send out to everybody. In addition, I want to thank Patrick, our business person, who was made his facility here at Pier 57 available for this session here today. And the layout, as you can see, with the medical team here and all the persons are here, coming and taking this thing seriously is an indication that we are on the right track. We hope and pray that we can see more of this around the country.
The COVID-19 death toll as of September 26th reached 120, and Dr. Mitchell says he is not comfortable with the rate of mortality given the size of our population.
I'm very concerned about the level of deaths for a small population. And it clearly is an indication that people are waiting too long. They are noticing signs, for example, maybe a fever, maybe a cold, sore throat, and other things, backache, and they're treating it as a normal complaint, when in fact that should urge them to move quickly and test. And most likely vaccinate at the same time. I think that's one of the messages I would like to send to them.
In concluding his interview with the GIS, Dr. Mitchell said he was very pleased with the commitment of the medical team and volunteers, as the fight is about saving lives. Medical professional and COVID-19 volunteer Dr. Jane Noel says the Ministry of Health must be commended for its decision to designate the top floor of the newly constructed Gouyave Polyclinic as a COVID-19 testing and vaccination center. Residents of St. Patrick, St. Mark, and St. John are encouraged to utilize the facility, which is closer to home, between 9 a.m. and 3 p.m. on Mondays, Wednesdays, and Thursdays. Following his recent visit to the clinic, Health Minister Honorable Nicholas Steele welcomed the addition of the new site as the ministry ramps up COVID-19 testing and vaccination throughout the island. Dr. Noel says the additional facility will relieve some of the pressure felt at the smaller clinics and give more time for other health services.
We've had the main stadium that has been looking after people, and we've had the health clinics, and obviously at the weekends we've had the mobile units which have been going around. But the idea of this clinic on the west coast is to really help people completely down the northwest coast, right from St. Patrick's downwards, because we realize to come into town, that's a difficult journey. It's extra money on the bus. If it's easy for them to just hop off the main bus route and come in here for us to either test them or vaccinate them. In the health clinics, they're also busy with all the normal clinical practice. So you have all the pregnant mothers and the diabetic feet to attend to and all those things. So we're hoping that this will take some pressure off the clinics so that they can actually do their general work.
The COVID vaccination and testing center started today, Monday. Dr. Noel expressed satisfaction with the turnout so far.
Good so far. I'm glad so many people have come out. I wasn't sure whether we'd be sitting here with no one the first day. We've tested maybe about 30 people so far. Well, no, actually we've tested a lot more. We've vaccinated about 30 people. We've had a lot of people coming in for testing. Also clarifying for people who maybe don't need testing. So I think a lot of it is also advising people. People are scared, they're worried, and we've just done a lot of counseling to people, and I think that's important.
In recent weeks, Grenada has seen a steady increase in the number of COVID-19 infections as the country transitioned to community spread. Health authorities have therefore been undertaking various public health interventions, including increased public education, testing, and vaccination to curb the spread. Community health nurse Colleen Rush appealed to residents to play their role in curbing the further spread of the virus by taking advantage of the opportunity to get tested and vaccinated.
We're asking persons from St. Mark, St. Patrick, St. John to come out in your numbers Mondays, Wednesdays and Thursdays from 9 a.m. to 3 p.m. to get your testing done and vaccination done. Once you're tested and vaccinated as well, that reduces the spread from you to other persons, from persons to you as well.
Individuals can also choose one of the two available COVID-19 vaccines. Pfizer is administered to individuals who are 12 years and older, and AstraZeneca is available to those who are 18 years and older. This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. Craig Charles, resident of the constituency of St. George Northwest, brought his two children to be tested and vaccinated at the pop-up clinic at Pier 57 on Sunday. In a GI's interview, he encouraged his colleagues to get tested and vaccinated. Having recently recovered from the dreaded virus, Craig is thankful that he had the opportunity to get vaccinated, as his symptoms were not that severe compared to stories he has heard from others.
As a gentleman who was diagnosed with COVID and I recovered and I was vaccinated, I was not sick. In the first 4 days, I was just headache, and after that I was good for the rest of the time. And I recovered nicely, and I just urging all the young ones, especially guys in Grand Mall and Fontana who play soccer, I urge you all to come out and get vaccinated. It's the best way forward.
I brought my 2 kids today to be vaccinated, and that's the best decision I think I made as a dad.
Shivana Manmorin also spoke with the GIS on why she believes it's important for people to make the decision to get vaccinated and tested.
I came out here to be tested, to know my status, as well as to get vaccinated, to protect not only me, but family members and friends that I am around. And it was a pleasure to see a lot of young folks out here today getting tested, knowing their status, because there are so many cases here, and you never know if you have it or you don't have it, so that's a good thing. And I just advise people to get vaccinated and make the right choice.
Overall, on the weekend, over 800 were tested at various clinics across the country, with over 80 testing positive. Finally, in the news, Minister for Foreign Affairs, International Business and CARICOM Affairs, Honorable Oliver Joseph, says countries globally must unite to control the spread of COVID-19. During his address at the 76th session of the United Nations General Assembly, Minister Joseph called on countries to adopt the One Health agenda at a global level. He expressed optimism that a One Health agenda will expose each country to an integrated policy which will lead to the prevention and efficient response to future outbreaks and diseases.
In the wake of COVID-19 pandemic, Grenada calls for advocacy for enabling environment to promote and adopt a One Health agenda at the global level, an approach that recognizes the connection between well-being, prosperity, and a healthy environment. As we seek to prevent, detect, and respond to future pandemics, non-communicable disease, including mental health, must also be examined. Our planetary health and climate change require an integrated policy, and among other things, cooperation, leadership, governance, and political will, as well as the sharing of resources and expertise to find better and more urgent solutions.
The session was held under the theme Building Resilience Through Hope to Recover from COVID-19, Rebuild Sustainably, Respond to the Needs of the Planet, Respect the Rights of People, and Revitalize the United Nations. Minister Joseph also addressed climate change, the impact of COVID-19 on the economy, the Blue Growth Agenda, the National Sustainable Development Plan, among other pertinent issues. That story just ended the national report for Monday, September 27th, recapping the top story. Prime Minister Dr. The Right Honorable Keith Mitchell pleased with a turnout at vaccination and testing clinic over the weekend. On behalf of the entire news and production team, I am Rikisha St. Louis saying thank you for joining us. Until next time.
All right, thank you very much. And we have received the dashboard for today, and that's from the Ministry of Health. And so we will be telling you those numbers right now. Now, what we can tell you we are seeing is a steady decline in the amount of new cases coming in. So 83 new cases of COVID-19 identified within the last 24 hours. And as it relates to the number of persons hospitalized, that has moved to 70. So the total active cases in Grenada stands at 1,795. Total recoveries, 3,080. And as it relates to deaths, 130, which means that there was an increase of 10 deaths within the last 24 hours. So 10 more people have died as a result of COVID-19, according to this current dashboard. All right, so these are the numbers for today as it relates to COVID-19. And the next thing that we have for you is the weather forecast, and that is what we received today from the Met Office. All right, now let's just let's see if there's any new update as it relates to the weather. You know, these numbers are so disappointing. I mean, even when we are seeing less persons are testing positive, and we're having a lot of persons who are now recovering. Thanks to God for that. But still, what we are seeing here, as it relates to the persons who are dying, it's just, it's hurting, you know, because I'm thinking, yo, to be averaging these kinds of numbers, it's just way too high. Way too high. I mean, there are bigger countries with a lot more infections, and you're not getting those kind of numbers. And I know that a lot of that probably would have to do with the Delta variant. But my God, you know. Anyway, here is your weather forecast. The weather is expected to be partly cloudy to cloudy with light to moderate showers and medium chance of thunder showers after midnight. Tonight's minimum temperature is expected to be about 23 degrees Celsius. Winds east northeasterly to east southeasterly at 5 to 15 miles per hour, becoming variable to calm at times. Seas slight to moderate, waves 3 to 5 feet in open waters. That's the weather report. And let's say hello to Ewell, Chris, Shadeen, Anne-Marie, Maureen, Peter, John, Rose, Osbert, Sydney, Mama Lintona, Cherry-Ann, Gwendolyn, Marianne, Monica, Gary, Peter, 2 Peters, Jillian, Ansha, Lucia, Cheryl, Kireen, Hansel, Bernice, Ventress, Randolph, Noreen, Nelo, Christine, Osbert, Lashlyn, Catherine, and Monica, Ventress. Who else is with us? I see Shirin and Java. Blessings to you as well. Tamara, Judy, Ruby, Rafi, Rafton, Imon, and Joyous. All right. Well, thank you, Lorraine, as well. And who else? Everybody else, actually. Claudette, Leslie, Yvonne, I said Oswika, right? And Timron, and Doris, and Charmaine, Derek, Vicky, and Shumshum, Anna, Miriam, and everyone else. Thank you for watching, and we're going to touch base with you tomorrow, God's willing. All right? So take care, guys. Gabriella, Clary, and Donis. Yeah, Dilos, big up your whole self, man. And Jake. Yeah, all right, Gary. Wendy Ann and Petra. Kirin, you could tell how to call him, you could pass for the thing, eh? Yeah, tell your son he could pass for the thing. You remember in the old days, boy? Miss Mary, Mommy sent me for the thing. Oh, God. You know, you're there in your house and somebody call you, hey, John, get a bowl and come for that. You know, what has happened to those days, man? Yo. Right now, man, I want to fight for this and fight for that and fight for this and time was, listen, just the other day I was a little boy running around Gouyave holding cockroach in drain. Now, I mean, when I look around, like, yo, things have changed so drastically, and I'm scared at what will change going along the way, right? Because there are so many things from then that is not happening anymore. So many things from then that was just the other day that doesn't exist anymore. So I'm asking myself, if that was our normal then, and it no longer exists, what in this normal now is going to be replaced by a new normal? I'm not ready for that yet. I still want to be able to say hello to the neighbor because that just feels right. to be able to say, hey, get a container, get a bag and come for that. Yeah, you know, but, yo, you remember back in the days, like, the neighborhood come together and they do things as a community? Yeah. So COVID is going to mess that up. And even if it wasn't COVID, that was being messed up already by just how we have changed over time. That's not good. Nah. And maybe some of these things are kind of like God's way of realigning us to what he expects us to as human beings. I mean, we are all, listen, we are made to connect. That's what we are made to do, not to feel like we are, you know, that we are achieving on our own merits, so much so that we feel like we are different from everybody else, that we are more successful and that we are more smart. We are, yo. And so then we start to categorize and classify ourselves as different from other people. And so then that difference starts getting in our head, and then it causes us to go apart from each other. Yeah. I know, because this one is able to pay the bank a little quicker than that one feel like he's you know, he's, you know, yo, we are all fighting over the size of our little nipples. It's still a nipple. Whether it's a big one or a small one, it's a nipple. You know, we're fighting over cars. As long as it takes you from point A to point B, it's still a car. Yeah, in our head, we've gotten so messed up. Yeah, so messed up. Yeah, we're going to see a car that looks old and run down, that is surely going to take you from point A to point B. The value of that is going to be 10. And something else that's a little bit iffier, but it looks good. Looks good. The value of that is going to be 100. And whereas you're sure that 10 is going to take you to that place, you're willing to take your chances with 100. Because the society has told you to accept what looks better than what works better. The society has taught us that it's okay to risk it, just so that we can fit in, rather than have the certainty of getting where we want to get, when we want to get there, how we want to get there. We've made it normal to chance everything that's important to us. And then we have lost our way with a lot of things, and we have blurred the lines when it comes to definition of things. So things used to be strictly defined. And over time, we've all started fighting for rights, and we've all started fighting for equality. And in the midst of all that, we lose ourselves. We lose things that were clearly defined, things that were clearly handed down to us so that it can enable our existence. We blur those lines. Yeah? And everybody has a right, and a right to a right. And what was supposed to be absolutely right and beyond question and reproach, it becomes fibble, because that's how we have brought it. We have robbed these things of its merit and of its true value and purpose. And then soon, let me tell you, a spade will no longer be a spade. You see? Soon, nothing will have a definite definition. And when things don't have a definite definition, must make, then law is going to break down. Law and order is going to break down, because everything will be challenged. And our very existence will be put into question. You would see. You would see. All of the things that we are running towards today, I promise you, as sure as the morning sun, the things that we as a people, the things that the world is running towards today will be the same things you are running away from tomorrow. Mark my words. So it might be pleasing and palatable, and oh gosh, it feels and sounds good to you today, and you would run towards it and with all your force and might. Because that's what the in thing is. Wait. As fast as it goes up, and as far as up as it can go, the higher you climb, hey, I ain't calling doom and gloom. I'm just saying, you shall reap what you sow. that the things that were created naturally and was meant to be, at the end of the day, it doesn't matter how much you twist and you bend it, just know that in the end it will be what it was meant to be. So all the wrongs that are coming to be right, those wrongs will be written to be right. You just wait and see. Anyway, I ain't coming for that any program, you know. But sometimes I'll get a little injection, a zugu. You understand? So anyway, I thought that I needed to say that for somebody out there, and maybe that somebody could be you. All right? Nothing is going to last forever. Even the things that feel like it's right. Nothing would last forever. Anyway, guys, thank you very much for your time. We'll be back tomorrow again, God's willing, and we'll have more for you. May God bless you and your family until we meet again. Tomorrow, God's willing, for sure, because you're going to follow the protocols, you're going to do what you have to do, and you'll be here again in one piece. God bless you. Let's go. In 5, 4, 3, 2, 1, and we all say, ja! No! We're coming back again. All the take all the time. Go and drink all the concoction. I'll be okay. Take care.